for oncology dispensing and gaps that are occurring in the area, for many practice sites, they can't fill a drug. There's restricted distribution to the drug. Many sites can't even actually give the first fill for that drug therapy. So it's being taken away, or it has to be utilized through a mail order pharmacy. And what that's doing is it's creating some lack of knowledge in some cases with patients. Caregivers may not be able to follow up correctly. So really providing that, if that first fill or continued fills at a practice site, in actually a community setting, physician setting, those are all key component pieces. So what are some gaps for dispensing? What are some gaps for dispensing oral oncolytics? I think it's a very important discussion. In fact, it's a discussion that's happening at different sites, different academic centers, community centers, large practices across the country. Some of the issues that patients are dealing with is the fact that they can't fill at their site of practice. So not being able to fill at the site of practice, utilizing mail order pharmacy, can create some confusion and also a lack of education in some cases as well. So I see that gap being a continued discussion or continued pressure in terms of addressing how to provide care at the facility where the patient's being seen. Because you can now have access to the EMR, lab access, some things that mail order pharmacies can't have. So that gap, I think, will be a continued discussion, and also it's going to be a great overall viewpoint on how things can change in the future with oral oncolytics.